One of the interesting things in what we've tried to do in Charleston is really provide the most comprehensive advanced forms of breast reconstruction to our patients. And we've been highly successful in doing this. Most recently, over the past couple of years, we've become sort of the center for the country that's specializing in perforator-based breast reconstruction. And the reason that this is more advanced than previous reconstructions is that this procedure takes the skin and fat from a woman's abdomen but preserves the muscles, unlike the previous procedures. We are very fortunate to be associated with such a high level of cancer care. The uniqueness to the program when compared to other programs throughout the country is that we have, I think, the most advanced multidisciplinary team available. We offer full range of not only the surgical treatment for cancer, the surgical treatment for reconstruction, we also have top-notch medical oncologists, radiation oncologists, and we have specific programs for women undergoing rehabilitation following breast cancer. We have really first-rate operating rooms with the most modern technology available. A uniqueness to our program is that we have an extremely high volume of breast reconstruction procedures. We do approximately 400 procedures a year related to breast reconstruction and revisional surgeries. We, as one of the few places in the country, offer three-dimensional nipple tattooing, and we have a tattoo artist coming from Florida once every couple months who does an outstanding job at tattooing the breast. And that really is the final touch. We are seeing more bilateral mastectomies performed. One of the things that is playing a role in that is certainly genetic testing. We see more patients who come in who may not have cancer at this point and who really have seen either their mother or an aunt or a sister go through the process, and knowing that they are a genetic carrier and at high risk for cancer are now deciding to go with prophylactic mastectomy. We can offer them a tremendous reconstruction now that is using their own tissue and is more natural. Especially in a younger patient, somebody in their 40s or 50s, putting implants in, you most certainly are going to have future surgeries to either replace the implant or to address implant issues, whether it's 5, 10, 15 years down the line. The average life expectancy of an implant is somewhere around 15 years. So in a younger patient, it makes tremendous sense to undergo a little bit of a bigger procedure early on, but having your own tissue, once you're through that initial postoperative period, that tissue will live with you the rest of your life. We see a lot of patients today come to Charleston who have had implant reconstruction or some other type of reconstruction done, basically because those are the procedures that are offered in their area. One of the things that we try to attract now to Charleston are people who may not be happy with the reconstruction that they have or have now changed their mind and would like to use their own tissue. That is, even though they've had other reconstructions done in the past, they still are an excellent candidate to have the DIEP or perforator flap surgery. We understand that during this time it's extremely difficult. They're seeing many physicians, whether it's medical oncologists or surgical oncologists, and we try to be as sensitive to their issues as possible and try to work with them in terms of scheduling, and having multiple sites and having the ability to see them at multiple sites I think really helps us accommodate patients. We offer all forms of reconstruction, and I think that is crucial when a patient is making a decision on who to come see. If you go see a physician who specializes in only one procedure, needless to say, that's the procedure that they're going to recommend, and that's the procedure that they're going to encourage their patients to have. At MUSC and at Hollings Cancer Center, we have the ability to perform any one of the reconstructions out there today. And so we work with the patient in making an informed decision to basically decide on the procedure that's best for them. And unlike the cancer care portion of their treatment, the reconstruction portion really is their decision. We certainly screen them and make sure that they are a candidate for the procedures which they're considering, but if they meet that criteria and are a reasonable candidate, they have a lot of control over what procedure they go with and which procedure they have done. And I feel that it's very important that we're able to offer all of the procedures to them to allow them to make the most informed decision they possibly can. The reason that I think somebody should choose Charleston and MUSC is not only for Hollings Cancer Center, but we also offer a tremendous place to visit. And so if we can sort of pair the top-notch medical care that people desire with a highly desirable place to visit, I think we really offer a tremendous program and offer a tremendous opportunity for patients to come to Charleston, for them and their families to be comfortable, to receive the highest level of care possible, and to really enjoy as much as possible a very difficult time. While some people travel a great distance to come see us, I think in their minds, and certainly in our minds, we hope that it is worth it and that we provide to them the highest level of care possible.